Good morning and welcome everybody to this iPlato seasonal flu webinar. My name's Daniel, I'm your trainer today, and I'll be taking you through how to set up and send out a flu campaign invitation. Um, I'm not alone today. I have my colleague Zoltan, who is manning the chat services. So you may find you're all muted. Don't worry, nothing to be alarmed about. It's just to allow the webinar to run as smoothly as possible for you. Any questions you may have, do feel free to pop them in the chat, and then we can look to answer them at the end of the session for you. Whilst we're just waiting for any late joiners to arrive, just to cover off a few things, I'll be going through the agenda that you can see on the screen in a moment for you, so we know exactly what we're doing. And of course, we're in the welcome and intro right now, so we have begun. But a few other points I would like to let you know about. If you are joining and you have not yet renamed yourself to have your full name on the participants list, please do so that we can see where you're from, so we can talk to you afterwards if needs as well. And also, as you can see on the screen here, oh, it's just gone. We can see that you have a chat function. If you haven't seen this already, wiggle your mouse on the screen and you will be able to see the chat function button. Click on that and you'll be able to open up the chat. To rename yourself, we have our Manage Participants page as well. You can click on the Manage Participants as indicated on the slide here, hover over your email address or login name, and click on Rename to enter your full name for us. That would be fantastic. Thank you. Another point that I want to take you through today as well, just to let you know, is also about our engagement hub today as well. Now with the engagement hub, that is sending out bulk messages with your CCG or STP. So before proceeding with your own flu invites this year, do quickly check with your CCG or STP to see if they're using the webinar hub before you proceed with your own flu examples today. Okay, so let's go through our agenda. So we have our welcome and intro, as we mentioned, we're going through that now. We're going to move on in a second to coding settings. And coding settings is all about the clinical codes that are set up by default in your Connect system, so that you can use those all-important automatic coding functions to code the fact that you have sent a text message to your patients. So we'll be going there first of all. We'll then look at creating a group, and that's the beginning of building our health campaign. So creating a group of people to send to. Once we've done that, we will then look at creating a template to use. So we can look at creating in specific templates for specific groups to invite, and how you can store those on your system and use them multiple times, however many times you wish. Alongside that, we'll also look then at activating a campaign. So within your template, if you wish, you can set up a trigger word. Now, with that trigger word, you can program a clinical code to go back to your patient record and update a patient response. So we're going to get you to be doing that on your system, and I'll show you how to do that in activating a campaign. And then we're going to put all of those pieces together and send out the flu message. So I'll show you how to put that together in your Connect system. We'll then look at the help page. Now we have a fabulous help page for sending out seasonal flu invites. We will take you to that page at the end of the session. You'll be able to find this via your Connect system, and I'll show you everything that's in there. It's going to take you through step by step on how to send a health campaign for the flu season. So I will make sure we look at that for you. And then once we've hit that, we'll have some time at the end for any questions via our chat function. And my lovely colleague Zoltan will be able to take over at that point and help answer any questions you put in as we go through the session today. Okay, so without further ado, let's move to our Connect system. So I'm going to move our screen across to our Connect system for you. You should all be familiar with this, our favorite system here. And we can see we've landed on the home summary page, just like we would when we log in. For everyone, just to recap, two pieces of important information sitting at the top here. We can see credit balance and last replication. Credit balance there, We can see 0 on the screen at the moment. That's because this is our demo site, and you can see that with the name at the top as well. Your own sites, of course, you'll see your own practice name here. Credit balance for our demo site shows 0. So that's what we have on our screen here. When you look at your own systems, you may also have 0, depending on how you're funded. If you are funded by your CCG, you may have a figure here. So if you have the figure there, do have a check and make sure you have enough credits to send your message today. In terms of credits, sending a single text message would cost 1 credit to send. Below this, we have last replication. That's showing today's date. That's what you want to see when you log into your system. It lets you know the last time that our Connect system and your clinical system synced up together. So that should always say the same thing. If it ever lags behind, contact our support team, and I'll show you where to get their details in the help section at the end. Okay, fantastic. Let's begin then by looking at our coding settings. So before we go into our menu for health campaigns, which is on the left-hand side here, we're going to go to our settings menu and just check our coding settings within the system, which sits just here on read code. Okay, so we're clicking on settings and we go to read code. Here on the screen, we have our example clinical codes built into the system. For yourselves, again, in your own systems, you will see your own relevant clinical codes there. So if you are a System 1 user, for example, you will see your own versions of those codes there. For anyone who is using SNOMED codes, we are fully compatible with SNOMED codes. If you have already started to move across to those, then in order to swap that over on your Connect system, you just need to contact our support team via email, and their email is help@iplato.com. And my web chat will pop that address into the chat for you, so you don't have to remember it, don't worry. Here we can see some the codes that will go back to your clinical system. The important one here for our purposes today, SMS out manual in the middle here. This code here will state that a text message has been sent to your patient. It is on and active. So as soon as you send out your health campaign, that clinical code will go back to your patient care history for EMIS users, or your patient journal for System 1 and Vision users, to automatically update that you have sent a text message to your patient. Just below that, we have SMS in, slightly different code we can see on the screen, exactly the same principle, but in reverse. So when a patient texts in with a response to your campaign, again, your patient care history for IMIS or patient journal for System 1 and TPP for System 1 and Vision will update automatically for you with that code to say you received a text. So your important takeaway from here, make sure that the codings are on, and that you have them on for your manual message, because that's what you'll be sending, and for any replies that you receive. Okay, now we're going to go to our groups to create a group of people to send to for your health campaign. Now, with health campaigns, the first place that you actually begin your building of a group is in your own clinical system. So you would need to run a search in your own clinical system, first of all, for the patients that you would like to target with your health campaign. Now, once you have that searched, you need to export that into either an Excel spreadsheet or a .csv file. Either will be fine. If you're not 100% sure how to do this, please contact your clinical support teams, your clinical systems support team to help you through that. Once you have that spreadsheet, you just need to make sure there's an important piece of information already on there, and that is for EMIS users, it will be the patient ID column. For Vision users, it's also patient ID. For any System 1 users, make sure that your spreadsheet has the NHS column. We'll be showing you an example of that in a moment, so keep an eye out for that when we bring that up for you. So once you've run that search, we then go to our Connect system. We go to the Campaigns menu on the left-hand side here. We open up the Campaigns menu, and we click on our first subject, Groups. On the screen, we can see a couple of example groups here, just running from left to right. We can see the group name here. In the middle, the date it was last created or changed. The group type being patients, and members indicates the number of patients that are in those groups. So we've got a nice little example layout here, but we're creating a new group today. So let's go straight to that. So we click on Create Group in the middle here. And the first thing we get to do is name our group. So I'm going to give an example today. I'm going to say that this is a flu invite. Apologies for my bad typing there. And I'm going to say it's for my over 65 group. You can be really specific with your group type and who's in there so that it's nice and clear when you come to send the message later exactly who you are going to be sending your message to. Group type we leave as patients. And then we click on the button down here saying Add Recipients. This takes us to our Edit Group page. Now you can see that the cursor has started in the recipient search box here. If you were creating a relatively small group, you are able to look up patients individually by name, but with flu season, we know we could be dealing with very large groups of information, so we want to make things nice and simple for yourselves. So what we need to do is have a look in this bottom left hand of the box where it says patient IDs. Now, an important point for everybody, if you are a Vision or EMIS user, you can leave that on patient ID there. If you are a System 1 user, then that works with the NHS number. So if you are System 1, you just need to click the button and change this box title to NHS numbers. I'm going to leave that on patient IDs today. And I'm then going to go to my spreadsheet. So in true Blue Peter fashion, I have one that I prepared earlier. And I'm just going to move to that one now for you. And that should be on the screen. So here we can see our spreadsheet. Just a small example for us today. Obviously, yours may be a lot longer. We can see here just another important point for our System 1 users. NHS number column here is listed. It is showing our NHS numbers, and it's showing it in no spaces. That is the format that you will need your NHS numbers to be in order to bring them into your Connect system. I'm using patient IDs today, so I'm simply going to select the column in question, and I'm going to copy the numbers. Once I've copied the numbers, I'm going to go back to our Connect system. And it's just going to transfer across now. There we go. In the bottom left hand, we have our patient IDs. I'm going to click in there and I'm going to paste in what I've copied. Don't worry that you can't see all of the numbers. They are there. All we need to do is get those IDs across to the right-hand side here to the recipients box. To do that, I'm just going to click this little blue button here. And by magic, they've popped across to the right-hand side. So you're now thinking, great, I've got my group, it's in the right place, it's ready to go. But there's a couple of things we get to check here. The first thing that you'll have noticed, the eagle-eyed amongst you, is the excluded button down here in the right-hand corner. If we click on this, we can see that the list has disappeared for me. This is because in our example, I've used a list of people who are all registered with mobiles. We can see that when I clicked excluded, we have a new title, list of recipients that has not been added into the group. Anyone on this list here is going to be someone who's registered at your practice, but they're not registered with a mobile number. So your Connect system will automatically filter those people out for you. And then if you do want to message them another way, you can simply highlight their details, copy them, and maybe paste them into your spreadsheet, for example, for safekeeping so that you can message them another way by email, for example, or letter, whatever it might be. Once you're happy that you've got those details saved for those patients without mobiles, we can click Included, and your patient list has returned. Once you're happy with your list, we click Save. And there we are, we've created our group, nice and simple. We can see again our group name on the left, nice and clear. It's my over 65s invite. It was created today, and there are 8 patients in that group. Now, a clever trick for you, if you do want to see your opted out patients who have opted out from receiving a text message reminder, you can click on your edit button here. And in the edit group box, we scroll down and we find export to Excel. Clicking on this will export the list of your patients in this group into an Excel spreadsheet for you. And in that spreadsheet, it will tell you who of your patients have opted out from receiving text messages. I'm just going to click cancel off this group because I'm not making any changes. Now, the good thing with groups is if you are inviting a very large portion of people to a flu invitation, you may want to break that up. You might not want to message everybody all in one go. Particularly if you are looking for people to call up to book a flu appointment, you don't want to jam your phone lines or have your reception staff fielding all of your patients in one go. So you can look to create multiple groups. If you have a very large list, let's say, for example, 500 people, and you wanted to send that in two groups, you could create one group and name it Over 65s Group 1, the second group Over 65s Group 2, for example, and split the list half and half for you. That way, you get to schedule when those messages go specifically. We'll be able to show you that when we come to put the message together at the end, so that you can time it so that the message goes out in nice steady intervals, or indeed when you have most of your reception staff available to field those calls when they come in, because we want those people to call in and book their flu jab. So there we are, that is our groups. So now that we've done our group, we need to create our template. So we go to our left-hand side and click on campaigns, and we go one down to templates. On the screen, we can see our example templates already. You may have a few on your own system, of course. Our examples here, we've got a few different ones. I would like everybody to focus on the one at the top here. The subject has been listed as flu invitation. iPlato actually sets up all its users with a flu example message. So it's you will have one in your systems there. If you need to use others, we actually have some example templates for the flu season as well. This is going to be in our help site as well. So I'll make sure that we tick that off as we go through the help section at the end of the webinar today. But just focusing on our flu example invite here today. We can see it's arranged by subject, flu invitation, and they're arranged in alphabetical order for us. So it's nice and easy for us to see which invitation we are using. We've put our surgery at the front here, or our iPlato surgery. So you can put your practice name at the front as well if you wish. The reason we do that as an example is basically to grab patient attention. When that text comes through and it pops up on someone's phone, we want them to see your surgery name at the front and center. And that's a nice way then hopefully to grab attention. The patient clicks into that message and responds to your campaign. We then have dear, and it says first name too. This is a mail merge example for you. This would automatically go to your group and fill in the relevant first name only of the patient that you're messaging. So you can personalize if you wish. You have that function. You don't necessarily have to use it if you do not wish. If you would simply like to say dear patient, then you can do. We then have the statement, you're eligible for a free flu jab, call the practice on, or text back decline to refuse. Now I'm just going to highlight decline here because we can see it's in capital letters. So for our automatic appointment reminder users, we know that patients can text the word cancel to cancel an appointment. Here's an example of a trigger word, what we're going to be looking at next. And this can be then programmed with a particular clinical code to capture a patient response. We'll be looking at in a moment. This is just a piece of text at this time, so keep that in your minds. I want you to remember that. We will be coming back to that. First of all, though, what I'd like to do is edit the template, because these templates that we have for you, they are there for you to adjust and use and make work for your practice. You're going to know your patients best, so we want you to be able to edit these so that they work for yourselves. To do that, you will see an edit and delete button on the right-hand side. You'll see this in the group section as well. Here we can see the edit button. If I click on edit, we have our edit template on the screen. Now I'm just going to do an example here. If I wanted to change anything on the message, I can click in, make an amendment, and then click save if I'm happy with my adjustments. Now, an important point for anyone else who's spotted already, we have our character count below here as well. Now, this character count will appear anytime that you are writing a text message. The reason for that is that a single SMS message is a maximum of 160 characters in length. Uh, you can send longer messages if you wish, but it's just to remember the credits from the home summary page. A single text message of 160 or less costs 1 credit to send. If you go over the 160, the message will still go. The system can absolutely send longer messages if you need them to do so, but it's to be aware that if you go over the 160, that will go as more than one message and therefore cost more than 1 credit to send. I'm happy with my adjustment here, so I'm just going to click Save. And there we go. It has updated itself on our template here. So if you have a template already and you want to amend it, you can do. Let's also show you how to actually create a template as well. So if you want to do something new. So if you are creating multiple invites for the flu campaign, slightly adjusted, for example, to maybe your different categories, then you can create those specific templates. What we can do in order to help you is we can simply copy and then paste the template and then make adjustments to it. So I'm going to copy the template we can see here. I'm going to go to Create Template, and I can paste in what we've copied. Okay, I'm now ready to create my new template. The first thing I'd like to do is just draw your attention to the subject at the top here. You can file things by subject, so if something you're creating fits into an existing subject, you can ask it to the system to file it under that as well for you. But I'm going to create a new one. I'm going to create Add New Subject so that the group that I've created and the template that I want to use for it are nice and clear to me when I come to send the message. So I'm going to Add New Subject. Flu invite over 65. I'm not going to make an adjustment to my template just for now. I'm just going to save this as an example for you. And there we go. We can see it on the screen now. So not only have we edited a template, we've now created a new one. I've named it accordingly so it's nice and clear which group this template relates to. And I am now ready to activate my trigger word of decline if we are going to be using one. So let's move to our trigger words activating a campaign. So we click on campaigns and we click on trigger words. On the screen, we have again our example prepped for a flu invite. Again, iPlato sets up this example for its practices. So when you have a look in your own system, if this is here, do check that code there. This is what we have on our training site here. Check that code in your own clinical system before proceeding with a flu campaign, of course. But just running from left to right, we can see how this is laid out for you. So we have our flu invite on the left-hand side, the name of the campaign, the clinical code it will be connected to, and the trigger word that that code is linked to. So we can see here it's the word decline. It's written in capitals on our system here, and we would recommend you writing it in capitals in both your template and here on your trigger words. If a patient texts back the word decline upper or lowercase, that doesn't matter to the system. It will still pick up that word for you and send the relevant clinical code back to your patient's care history for EMIS or your patient journal for Vision or System 1. But it's just nice and clear then on your system, so you can see it straight away and go, yep, that's my trigger word. But interestingly, we can see here that we have an end date and it's saying status red symbol there. So that means that right now, this campaign has gone past its end date. So even if someone texts back the word decline, nothing would actually happen because it's in a red status. So the first thing we would like to be able to show you is how to turn that on. All we need to do is go to our little edit button, our friendly edit button we saw before, click on that. We have our edit campaign box, and at the bottom we have the date. I'm just going to select today's date as an example for you. I'm just going to move that there and then click save. And we can see the status has gone green. That's now active and ready to work. So now that is ready to send back the clinical code in question that's been attached to the system here as soon as a patient responds with the relevant trigger word. Now, with your campaign, you are likely to receive most of your responses within the first 48 to 72 hours, but we do suggest putting the end date of your campaign a few weeks in advance. You're bound to get your late responders as well, those ones who pick up the phone, have a look at the text, and then perhaps don't respond straight away, much like my family. So you may have that, but they give that end date a little bit of time so that you can capture all the patient responses that you would want from your health campaign. If you do want to end a campaign early and deactivate the trigger word, you would simply click on Edit, and you can put the date into the past in order to then deactivate the campaign. If we need to add a trigger word, it's nice and straightforward as well, because we have our nice friendly button at the top here, Add New. So I'm going to click there for you. And we have our Add Campaign box. So what we need to do is fill in our campaign name. We know that this one is for the flu. And we can have a campaign trigger word. And I'm going to type this in capitals. We then get to add the read code. So we can add either a read code or the read code, which will then populate the read code term for you. When you come to this page, when you're doing your search in your clinical system for your patients, when you're creating your group, we do suggest maybe grabbing the relevant read codes for any trigger words you may want to do, so that you have that ready for this section. I'm going to type this one into here. As you type, it will start bringing up the read code it thinks you want to use. So I'm just going to give you an example here. We select the relevant one, and then that populates the term below for us. Again, if you are Vision or System 1 users, you would type in the relevant clinical code for your clinical system. And again, if you're SNOMED users and you've been moved across, our support team have moved you across to SNOMED codes, you'll be able to come in here and type in the relevant SNOMED code in exactly the same way for you. Now I'm going to put an end date on my campaign of a couple of weeks. But notice, now that I've put an end date in, I've filled in everything I need to, but the save button isn't available to me. That's because on my example here, I have the word decline already being used on an active campaign. Because you are going to be tying in a unique clinical code to a unique trigger word, you cannot use the same trigger word across two campaigns that are running at the same time. So you may need to use an alternative word if you are already using the word decline, for example, somewhere else. So I will use refuse as an example, and then click Save. That's gone straight into the system. That's ready to use. We can see our code there of refuse. If you do make any adjustments to your trigger words before sending, do just double check that you have the correct trigger word for use in your templates before you send. Okay, fantastic. We have now created our group. We've created our templates, maybe created multiple templates, and we've set up our trigger word to use to capture a patient response if they wish to decline or refuse a flu jab. All that's left to do is build that into your campaign and send out the message. So we're going to go to campaigns on the left-hand side, and we're going to new message at the top here. The first place we come to is step 1, select recipients. Again, if you do want to send a quick message, a manual message to 1 or 2 patients, we can do so here, but we've made our things nice and simple for ourselves. So at the bottom here, we have our selected groups. We're going to look for the group that we created, which was the flu invite over 65s. And then to get those patients in the correct side, we're just going to use the little arrow. And there they are. Patients are on the correct side for you. Now, an important point for everybody, you may notice that the number of recipients that shows here may be less than the original spreadsheet that you pulled from your clinical system. There'll be a couple of reasons for that. It may be that some of those patients have been removed because they're not registered with a mobile number, as we mentioned when we were creating our groups. It may also be that patients have been opted out. So this list here is the patients that are going to receive the message. It's not going to show those patients who have been opted out from receiving text messages or health campaign messages. So you may notice that's a bit lower. It's to be expected, so don't worry. Let's click on Next. We're going to move to the next stage, which is step 2, Create Message. Again, we need our message on the right-hand side here, so we can free type if we need to, but we've done the hard work. We've got an invitation, and because I've named the subject nice and clearly, I know exactly which one I want to use because it was my over 65s group, so I'm going to use my over 65s invite. Now, the bold header is the subject, so I need to click the text below. I'm going to click the arrow, and that's moved across to the right-hand side. Now, you may also notice down here, it says attach surgery details to message. If you click this, this will add a link to your text that will provide some basic information about the practice when the patient clicks on it, opening times, location. Now, be careful with that one because the link itself, it does count to the characters on your message. So if you are using quite a lot of characters in your message already, you may not want to click that because it's going to maybe take you over the 160 limit for a single message. It's up to yourselves if you want to use it. In our example, we've got the surgery name front and center as I mentioned, so I'm happy that my patients know exactly where that's coming from. So I'm going to click Next. We then get to step 3, sending options. So the first thing I get to do is to schedule when it goes. Now you may want it to go straight away. If you wish, you just leave the button there on Send Now. I'm going to click Send Later as an example. Thinking about why you may want to use Send Later, thinking back to how we created our groups, we might have created multiple groups because we're messaging a very large amount of patients. So I may want to send one group at one time, another group at another time. That way I don't have loads of people calling in straight away. Also, I may want to send it so that I have the most of my reception staff on the phones when the patients receive that message so that they can call in and book that all-important flu jab. It may be that I haven't yet received the flu vaccinations, so I need to send it once those arrive when I know they're coming so that they go out when I can book people in. So I'm going to pretend that I need to send this message today, next Monday. It's going to go next Monday. But I want it to go in the afternoon. I want it to go after the morning rush of phone calls. So I'm going to schedule this to go at 2 o'clock in the afternoon. Now, I would like everyone to take away this key point here. You can see that the time that I've set is in a 24-hour clock. You have full control over exactly when your manual messages go. So if you were to accidentally put 02, that is 2 in the morning, you might wake up a few people up. They may not be too happy with you. So do keep an eye on that when you come to send your message. The next step here is adding a clinical code to the message itself. We've already added a clinical code to our trigger word, but here we get to add a code to the message so that when you message out to all your patients, every single patient record that for a patient you're sending to, that clinical code is going to go back to their patient care history for EMIS or patient journal for System 1 Vision. So we're going to click Add, and we get to add the read code. So I'm going to pop in my example read code, which we can type. And as you can see, it starts guessing at the one that you would like to use. This is the one that I use as an example. Again, please check in your own clinical systems which one you would like to use. Now, if everything you want is in the clinical code here, that's great, but we've got a really helpful extra button here called Read Code Comment. This is a free text box, and you can actually type in extra information, which will then go back with your clinical code and update your patient record for you. So in this case, I'm saying this was sent via iPlato. You could say sent via Connect or SMS, whatever you might need it to do. So I'm going to click Save, and that's saved ready for me. Finally, we come to Reply Email. Now, with the reply email, this is a really useful function and something to be aware of. When you have a patient message you back, if you are using a trigger word and you're asking people to respond with the word decline, you're going to be able to see that in the messages inbox, and I'm going to be able to show you that in just a moment. But the system would also like to keep you apprised of patient responses that come in. What the system's going to do is it's going to take that patient text, it's going to turn that into an email and send it to an email address of your choosing. So that could be an individual if you want to receive it yourself. It could be that it goes to a generic email for your practice. To control where that email goes, we need to click change. What you're going to see is on the example screen, the person who is using the system. So on our training system, we've got an example email at the top. So for yourselves, that would show your own email there. If you want to change that, we just click on custom email list. We type in our example email. So I've given an example one here. We need to click this little plus button here so that it's in this custom email list box below. Once it's in there, we click save, and that's done. I now know that my replies are going to go to that email there for me. Once we've done all that, we are now ready to send. So at this point, we would click confirm to send. And we're going to get this new box here, message confirmation summary. Now, this is a really good little piece of information here, gives us a chance to just take a breath and have a check through everything we've done, because we may have created our group from scratch, we may have created our template fresh, so we get a chance just to double check everything. At the top here, we have the message, we have how many characters, how many recipients, and the amount of messages that are going to be used, which means we also get a little heading here, what your current credit balance is and what it will be after sending. Now here on our training environment, we can see a minus number. If you are funded by your CCG and your credits show as a number on your home summary page, if it goes into minus figures when you see this page here, please click cancel and contact your CCG about topping up your credits. If you are funded or self-funded and you pay at the end of the month and your credit balance always shows zero, then it will show minus figures underneath and you would be able to send the message. If you're in any way unsure about your credits, and how you're funded, do contact your CCG. We can see the scheduled delivery, and I've set that for the 17th. That's going exactly when I wanted it to. We can see the default recode that we saw earlier. So that was our code under the settings menu that we saw earlier, and my custom recode that I've entered just now, and also the reply email that I want any replies to go to. Now, rather cleverly at the bottom here, if I tick this button here, then this confirmation summary will be sent as an email to that email address that I've put in. And that's a nice way to just keep a record of everything that you've been sending out as a manual message or a health campaign to your patients. So we've gone through our steps, we've added our group, we've set the message we want to use from our templates, we've set when it would like it to go, the coding, and we've checked our message confirmation summary. We are now ready at this point to click send. So I'm going to press send here. We can see the message lets us know that it's ready for delivery. I click OK, and we're taken back to the beginning. So there we go. We have now built and sent our flu campaign. Now, you may be thinking, that's great, Daniel. Thank you so much for that. But what happens now? Well, let me show you. So the first thing we're going to have a look at is the Messages tab. For those of you who have already seen, it's just above Campaigns on the left-hand side there. If I click on this, we will see that it looks very much like an email system, inbox, outbox, and sendbox. It's for text messages instead. When we click send, the first place our message is going to go is the outbox. So I'm going to show you that here. And we can see that our messages is ready to be sent out. So you will see your message in here. For any health campaigns that you send to multiple recipients, instead of listing by individual name, you'll see them listed as multiple recipients on the screen. If you need to see who you've been sending to, then you would simply click into the magnifying glass here, and it will take you to a page to show you who you have messaged. Just going to return to the outbox here. If you need to, you can edit or even delete your message before going if you need to. But with any editing or deleting in the outbox, do make sure you do that at least an hour before sending. Once your message has been sent, it will turn up in the sent box, of course. So we'll be waiting for that to come into here. And when you receive replies, you'll find that in the inbox. So I have an example on the screen for you. We have a person having text back the word decline. So we can see that in our inbox here. Okay, fantastic. So there we go. We've had a look at where the message goes from. If you would like any info on sending out a campaign, then you can always get in contact with us, with our support team. That's at help@iplato.com, and also our training team as well at training@iplato.com as well. Now, I do have one other area to show you within the system, because the eagle-eyed amongst you again may have noticed that when I clicked on campaigns, there was another subject here, call recall at the bottom. So we are going to have a look at that. I'm going to click on call recall. And just before we get into the main part of this, I want to let you know what call recall can do for you. So when you send out a text message to your patients, the system will send that as an SMS, as a text. And as I mentioned, that costs 1 credit to send if it's going as one message. For those practices using the MyGP app, the system is clever enough to know that for anybody who has downloaded the MyGP app and is using it as a patient at your practice. If they have, your Connect system will take that health campaign message that you've sent, and it will turn that into a data message, send it to the patient's MyGP app over the internet. That goes for free, doesn't cost any credits to send. But Call Recall will allow you to target your MyGP users. So you will be able to send that message out to your patients, and you will then be able to offer them the chance to simply book their flu jab invite straight through the app, saving those phone calls into your practice as well. So I'm going to click on Add New. And the first thing we get to do in our Call Recall campaign is select our patients. So as before, we can either look up patients individually, but again, we may be dealing with large bulk groups of patients. So we would put our patients in the patient list here. And we move them across to selected recipients on the right-hand side. If there are any patients that are excluded, we can export them here. If we scroll down, we can then see step 2, create your message. So here we can use templates in order to create customized messages to send to your patients. So here we can create a message for those patients who in our list don't use the MyGP app, and you can use your normal templates to say, please call us for a flu jab to book your flu jab, or to text decline to refuse. Within your call recall, you can still use your trigger words. In the data message on the left-hand side, this is for your MyGP patients. So with data messages, there's no limit on the number of characters because that goes over the internet as data message and goes for free. So you can let your patients know that they can book a flu jab that it's coming up, and they can book that through the MyGP app. Step 3, this is where it differs slightly. We get to select a session type to invite the patients. Now for this section, what we are doing is selecting a particular slot type to make available in the MyGP app just for those patients that we are messaging with our flu invite. For this, you may want to create a specific slot type to use for that very purpose. I'm going to use my example one here of flu vaccination. And I'm going to rename it in the button call to action section here. And I'm just going to call it flu jab. That way, when the patient looks at their MyGP app, they're going to see a button that says book flu jab. We then scroll down and we just need to decide when this invite is going to be available. I'm going to send my message on Monday again as an example. So I would like the button to appear in the app on Monday, and I would like it to end at the end of the month. We then get to choose when it goes. I don't want anyone to see the button before the message goes, so we're going to send at the same day on the Monday, and I'm going to send it at the same time because it's nice to have this go out after the morning rush, just in case people do call in. We then get to add the read code. So just like we added a clinical code to attach to the message we sent in our health campaign, we can do exactly the same for your call recall campaign. What we would want to do is use our national codes there. So we select that, and then we then type in the code that we want to use. So I'm going to use exactly the same example that I used from last time. Select, and it populates the link below. And we have the read code comment again, just as before, so we can put that extra text in if we need to. At that point, we can click confirm to send. That will bring up the same message confirmation summary box we saw earlier. And if you are then happy, you can still send that copy of the reply email there, and we can also click send to send the message. I'm just going to click cancel on this one for this example. And that is how you can use call recall. So I hope everyone has taken a lot of information in there. I know that I've been speaking for a while and you may have been trying to make notes. Don't worry, because this is where we make sure we've got everything that you need, because we've got our flu season help site, and I want to show you that now. So in the top right hand corner, we can see the help button. It sits there wherever you are within your Connect system, so you can always access it. So I'm going to click this and it's going to open up a new web page for me. Right at the top, we have seasonal flu campaign. If we click in here, we're going to get taken to our website for the flu campaign. A little reminder again, just as I mentioned at the beginning of the webinar today, iPlato also offer a number of regional flu reminder services with your CCGs and STPs. So before running your own local flu campaign, do check with them just in case they're using our centralized service, the MyGP Engagement Hub. If you do have any questions about the Engagement Hub or need to request any information, about the Engagement Hub, then you can email them at the email address there. But let's focus on what we were doing today. So our seasonal flu help page here has step-by-step guides on everything we've gone through today, including the bits you need to do before you get to your Connect system. So we can see here in preparation, seasonal flu pre-checklist. If we click here, we actually get a quick checklist of the things we need to do so that we're ready to send straight away when we come to our Connect system, such as deciding when your campaign is going to go and double checking that you have the credits available in order to send. We also have the message templates. If I click in here for you, we'll see a number of templates that you can use. Now, these are all examples. They've all been built into the web page here to be 160 characters or under. But please feel free to highlight, copy, and amend to your heart's content. Again, this is so that you can customize your messages so that it works for your practice and your patients. When you're amending them, of course, do keep an eye on your character count in your Connect system. Once you've done those, we can then go to our step-by-step guide. We can see that it's been labeled out just as we've done the webinar today. So we can look at creating our group, creating our templates, creating the trigger word, and then sending out the campaign. So just as a quick example, let's go into create group. We even have some helpful videos for you as well. So you can click and play the videos to help remind you, if you're a bit more of a visual learner, see that on your help page here. And we have our step-by-step instructions with screenshots as well to take you through how to do step 1, creating groups. And then we can move on to step 2, creating templates and so on. Again, another video there to help you through sending out these health campaigns. We also have that section on call recall as well. So you can always come into here to have a look at the help page for call recall. And if you've loved our webinar so much and you want to book in again, or you would like others to do so, then you can book in using future webinars using our webinar hub here. Once you've actually sent your invite, then we do also have a post-invite checklist. If I click on this one for us, we can see some examples of things that you can check to help get the most of your health campaign from your Connect system, such as checking your replies, checking your undelivered reports, seeing if any messages failed or expired, for example, and also looking at your next steps in terms of running another campaign. If you do experience any technical problems, then you can always check for any known issues, but also, importantly, there's a link at the bottom here for contacting support. So if you need to, you've already got the email in the chat there, help@iplato.com. Their email is also in here for you, but also we have a contact number as well if needed. You can find this in here. You'll find their contact section also on the main help page on the help button in your Connect system. But there we are. There we have our beautiful new help page there, all ready and waiting for you. We've gone through every section that in terms of building a health campaign today. So we've looked at being able to export your list out of your clinical system into a spreadsheet, making sure we have the relevant patient ID or NHS number, depending on your clinical system. We've looked at creating that group and why you might use multiple groups and how you can use that to best effect. And indeed, multiple templates as well, making sure that they're labeled clearly so you know when you come to send your message which group and which health campaign, which message are all tying in together. We've also looked at using and creating trigger words, programming in that clinical code to be attached to a particular trigger word. And then we've looked at being able to send out that health campaign, sending out selecting your group, selecting your template, adding your read code or your clinical code to your message, and then sending that out and seeing where that ends up in the messages tab as well. So thank you ever so much for listening to me. I hope you've enjoyed the session itself. We've now reached the Q&A section of our webinar today. So just for a change, so you don't have to listen to my voice for the whole time, I'm going to hand over now to my colleague Zoltan, who's going to take you through the Q&A as well for you.
Hi, good afternoon, everybody. I would like to say thank you to joining our first flu webinar in 2020 in this beautiful hot sunny day. My colleague Dania covered a lot of useful information today, how to send the flu campaign within your MyGP Connect system. And Dania showed us how to create a group, create template, add the trigger word and read code or SNOMED code behind, and in the end, how to send out the campaign for your patients. If you have any question, the only thing you need to do, wiggle your mouse and the toolbar will pop up on your screen. Click on the chat functionality, you can send a message to the group or you can send a message back to me. For those who does not have any question, please feel free to go back to your day. And let's have a look at the questions what we had today. So first of all, I just wanted to mention that someone was asking about the template, and already Dania, my colleague, showed on the help page. Let me see the screen. Would you mind to go back to the help page again, Dania, just in case. So again, you're going to your clinic MyGP Connect system, and top of the right-hand side, you need to click on Help and Seasonal Flu Campaign in the bracket top of the screen. When you click on that, sees a seasonal flu invite message, and all of the template will be just listed. As Daniel mentioned, you just need to copy and paste it into your system. Okay, the next question was how many patients we can add maximum in one group. You can add up to 6,000 patients in one group. Okay. The next question was single and duplicate numbers. So is automatically created this group in the first instance when they're installing the MyGP Connect system at your practice. Single numbers is holding all of your patient with a mobile number. It's only one patient per mobile number. If you're talking about the duplicate numbers, it's all of your patient who's sharing the same number. Let's say, for example, a mom with a son or with a husband exactly in the same mobile number. After that, we had a question about the dummy patient, if we can test it out, how is the message looks like before we reaching the patients. So that is a really good functionality on the system. So I'm going to ask Danielle, if you don't mind to go back to your MyGP Connect system and click on settings. Okay, and we're going to click on contacts on the submenu. Yep, perfect. So I just wanted to show you there that is super easy. If you would like to test it out, the message before you're sending out for your patients, log onto your system, click on settings, contacts, and you just literally need to add your mobile number to the system, and exactly the same step as Dania showed you today, step 1, 2, 3, just sending the message just for yourself. On the step 1, Dania is going to show as a test for us. Okay, and we're going back to the campaign on the left-hand side and new message. It's very important if you would like to test it out, you just need to obviously search on that test mobile number, but the first step in, as it's saying patients, we need to change that to contacts as Daniel showing on the screen for us. So in that point is easily that name that you added to the system as a test or for yourself, you can easily just move across and you can test out the message, how it looks like from the patient perspective. Right. Okay. If you have any other question, please don't. Please feel free, wiggle your mouse and send a message to us. If you do not have any question, please feel free to go back to your day. We're still going to be in the background for a few 4 minutes, just in case if you have any other question, and obviously we can help out with them.
Thank you very much indeed, Zoltan. That was lovely. And thank you everybody for attending. If you are exiting now, thank you ever so much for your time. I do hope you got what you needed from the webinar today. And do have a look at that help page. Just log into your Connect system, click help, and have a look there. If there are any more questions, absolutely. My colleague Zoltan is still in the chat. As I say, I'm still here as well. But as my colleague mentioned, that was our first webinar for flu season this year. So thank you ever so much for all attending, the very first one this year. Delighted that you were all able to join us. Thank you ever so much indeed for your time. And I do hope to see you again sometime. Thank you very much indeed. If anyone does have any questions, do feel free to access the chat and let us know. If you do want to post anything, we're here for another couple of minutes, so more than happy to answer any questions you may have. But otherwise, yes, it might be lunchtime. It might be time for a well-earned cup of tea. I can see some questions coming in. And there's a question here asking about where I can rewatch the webinar. Great question there. Thank you so much for that one. We will be uploading pre-recorded webinars. So keep an eye out in the help pages. We will load that up in there for you. And you'll be able to click and rewatch to your heart's content. I'm delighted that you want to hear my voice again. Thank you so much. Any final questions from anybody on any part of what we've gone through? Anyone want to recap anything?
James and Joanne, if you have any question, just please wiggle your mouse. You can use the chat function to send a message to us or send a private message to me. That means, Daniel, you covered a lot of useful information.
You're very kind, Zoltan. Thank you. I think that is drawing us nicely to the end of our session today then. So again, thank you everybody for attending. The last people in the webinar here, James, Johanna, if you have any final questions, do let us know. But otherwise, we're going to draw the session to a close now. I hope you enjoyed your time today. And again, thank you for attending the first iPlato Flu webinar of 2020. Thank you very much, everybody. Have a very good rest of your day. Take care.